Presented by Vishwas Rajawat, Suryansh Chauhan, Vikas Singh Tomar, Vijay Singh, Vishal Sharma, Yash Singh. So, our topic is safety measures from coronavirus. What is coronavirus? The coronavirus is the virus that causes illness ranging from the common cold to more severe diseases such as severe acute respiratory syndrome and Middle East respiratory syndrome, according to the WHO. The new coronavirus, the seventh known to affect humans, has been named COVID-19. It started spreading from Wuhan, China on December 31. COVID-19 is thought to have originated in a seafood market where wildlife was sold illegally. How coronavirus spread?
Most people are being infected from other peoples when in close contact. It probably spreads the same way as cold and flu are droplets which are created when we talk, cough, and sneeze. Pupils can get infected when these droplets enter the nose, eyes, or mouth, or when they are inhaled. Touching contaminated objects puts the droplets onto your hand. If you touch your face, the droplets can enter your nose, eyes, and mouth. Some pupils have been infected following contact with an infected person with minimal or no symptoms.
Symptoms of coronavirus. Common symptoms of coronavirus are fever, dry cough, tiredness. Less common symptoms are aches and pains, sore throat, diarrhea, congestion, headache, loss of taste or smell, a rash on skin or discoloration of finger or toes. Serious symptoms are difficulty breathing or shortness of breath, chest pain or pressure, loss of speech or movement.
In December 2019, the Chinese authorities notified the world that a virus was spreading through their communities. In the following months, it spread to other countries, with cases doubling within days. This virus is the severe acute respiratory syndrome-related coronavirus 2 that causes the disease called COVID-19 and that everyone simply calls coronavirus. What actually happens when it infects a human, and what should we all do? A virus is really just a hull around genetic material and a few proteins, arguably not even a living thing. It can only make more of itself by entering a living cell. Corona may spread via surfaces, but it's still uncertain how long it can survive on them. Its main way of spreading seems to be droplet infection, when people cough, or if you touch someone who's ill and then your face, say rubbing your eyes or nose. The virus starts its journey here and then hitches a ride as a stowaway deeper into the body. Its destinations are the intestines, the spleen or the lungs, where it can have the most dramatic effect. Even just a few coronaviruses can cause quite a dramatic situation. The lungs are lined with billions of epithelial cells. These are the border cells of your body, lining your organs and mucosa, waiting to be infected. Corona connects to a specific receptor on its victim's membranes to inject its genetic material. The cell, ignorant of what's happening, executes the new instructions, which are pretty simple: copy and reassemble. It fills up with more and more copies of the original virus until it reaches a critical point and receives one final order: self-destruct. The cell sort of melts away, releasing new corona particles, ready to attack more cells. The number of infected cells grows exponentially. After about 10 days, millions of body cells are infected and billions of viruses swarm the lungs. The virus has not caused too much damage yet, but corona is now going to release a real beast on you, your own immune system. The immune system, while there to protect you, can actually be pretty dangerous to yourself and needs tight regulation. And as immune cells pour into the lungs to fight the virus, corona infects some of them and creates confusion. Cells have neither ears nor eyes. They communicate mostly via tiny information proteins called cytokines. Nearly every important immune reaction is controlled by them. Corona causes infected immune cells to overreact and yell bloody murder. In a sense, it puts the immune system into a fighting frenzy and sends way more soldiers than it should, wasting its resources and causing damage. Two kinds of cells in particular wreak havoc. First, neutrophils, which are great at killing stuff, including ourselves. As they arrive in their thousands, they start pumping out enzymes that destroy as many friends as enemies. The other important type of cells that go into a frenzy are killer T cells, which usually order infected cells to commit controlled suicide. Confused as they are, they start ordering healthy cells to kill themselves too. The more and more immune cells arrive, the more damage they do, and the more healthy lung tissue they kill. This might get so bad that it can cause permanent, irreversible damage that leads to lifelong disabilities. In most cases, the immune system slowly regains control. It kills the infected cells, intercepts the viruses trying to infect new ones, and cleans up the battlefield. Recovery begins. The majority of people infected by corona will get through it with relatively mild symptoms. But many cases become severe or even critical. We don't know the percentage because not all cases have been identified, but it's safe to say that there is a lot more than with the flu. In more severe cases, millions of epithelial cells have died, and with them, the lung's protective lining is gone. That means that the alveoli, tiny air sacs via which breathing occurs, can be infected by bacteria that aren't usually a big problem. Patients get pneumonia, respiration becomes hard or even fails, and patients need ventilators to survive. The immune system has fought at full capacity for weeks and made millions of antiviral weapons. And as thousands of bacteria rapidly multiply, it is overwhelmed. They enter the blood and overrun the body. If this happens, death is very likely. The coronavirus is often compared to the flu, but actually, it's much more dangerous. While the exact death rate is hard to pin down during an ongoing pandemic, we know for sure that it's much more contagious and spreads faster than the flu. There are two futures for a pandemic like corona: fast and slow. Which future we will see depends on how we all react to it in the early days of the outbreak. A fast pandemic will be horrible and cost many lives. A slow pandemic will not be remembered by the history books. The worst-case scenario for a fast pandemic begins with a very rapid rate of infection because there are no countermeasures in place to slow it down. Why is this so bad? In a fast pandemic, many people get sick at the same time. If the numbers get too large, healthcare systems become unable to handle it. There aren't enough resources like medical staff or equipment like ventilators left to help everybody. People will die untreated. And as more healthcare workers get sick themselves, the capacity of healthcare systems
How to stay safe from corona. The very first step is to maintain social distancing. Social distancing, also called physical distancing, means keeping a safe distance between yourself and other people who are not from your household. To practice social or physical distancing, stay at least 6 feet, about 2 arms length, from other people who are not from your household in both indoors and outdoors.
Stay home, stay safe. Social distancing can make it harder for the virus to spread as the droplets are unlikely to travel too far. However, there is still a risk. Following stay at home orders reduces the risk even more by removing human contact, except with family members in the home.
Wash your hands often for at least 20 seconds. Hand washing remains the number one tip for preventing the spread of coronavirus COVID-19. It's common sense and it works. However, it must be done properly and with soap and water. When soap and water are not available, the next best option is to use an alcohol. Avoid touching your eyes, nose, and mouth with unwashed hands. Hand touch many surfaces and can pick up viruses. Once contaminated hands can transfer the virus to your eyes, nose, or mouth. From there, the virus can enter your body and wear a mask when you go outside. We should wear a mask in public settings and when around people who don't live in our household, especially when other social distancing measures are difficult to maintain. Masks are mostly likely to reduce the spread of COVID-19 when they are widely used by the people in public settings. But masks should not be worn by the children under the age of 2 or anyone who has trouble breathing, is unconscious, incapable, or otherwise unable to remove the mask without assistance.
Eat healthy and stay healthy. Good nutrition is circular for health, particularly in times when the immune system might need to fight back. Limited access to fresh foods may compromise opportunities to continue eating a healthy and varied diet. It can also potentially lead to an increased consumption of high processed food, which tend to be high in fat, sugars, and salt. Nonetheless, even with a few and limited ingredients, one can continue eating a diet that supports good health.
Seek a doctor if you have fever, cough, and difficulty in breathing. If you have a fever, cough, and difficulty breathing, seek medical attention but call by telephone in advance if possible and follow the direction of a local health authority. Calling in advance will allow your healthcare provider to quickly direct you to the right health facility. This will also protect you and help prevent spread of virus and other infections.
Stop traveling much. You can get COVID-19 during your travels. You may feel well and not have any symptoms, but you can still spread COVID-19 to others. You and your travelers' companions, including children, may spread COVID-19 to other people, including your family, friends, and community for 14 days after you were exposed to the virus. Do's and Do's. Wash your hands. Cover your mouth and nose. Consult a doctor. Don'ts. Avoid close contact with anyone. Do not split anywhere. Avoid using public transport. Do not use over the counter medicine. At last, I want to say that we all should respect doctors. Doctors are in the front line of the battle against coronavirus pandemic. They keep their life in risk and help others from COVID-19. They stay far from their family and make sure that we can live with our family. We should respect doctors and others who stay outside for us.